Hello, I am Ryan Besnay, Director of Education for Advantage Ambulance, and today we're going to be discussing your roles and responsibilities as an EMT on a CCT call.
How to attach the tray. After we've already got the patient already loaded up on the gurney, attached, multiple points of securement with the seat belts, we're going to add the tray on now. First thing we want to do is we're going to lift up these IV poles into position. Some gurneys will have two, one on each side. This one only has one, so make sure it is secured here, and then we're going to come in with the tray. All right, so when we come in with the tray, we want to make sure these U points here are going to go onto the handle. The larger connection is going to be more towards the patient head. Make sure you have your partner for this point because you're most likely going to need to squeeze the mattress to get it on. So we are going with these U connections here, squeeze that in so that this guy will sit right over the patient. Make sure that our points of contact are all on there. And then we are going to come in and make sure we attach our hooks here, hard points of contact, and make sure it's secured. Lauren's going to come in and work that side while I come in on this side. Here, flip it up to tighten it and make sure we pull down on the strap to make sure that it is fully secured. Give it a little wiggle, make sure it doesn't move. Perfect. Next, we're going to come in with the monitor. The tray can be used with either the monitor, it can be used with the pumps, it can be used with the ventilator, it can be used with the airvo as well. So multiple different pieces of equipment we can use to attach to this guy. Make sure that we always use hard points of contact on our monitor or our pump, whatever we are hooking to it. I'm going to come in and with the monitor here, make sure that the monitor is facing the patient here. With our hard points of contact, I just want to make sure that we go through the handle here, not over the saddlebags here. Sometimes with the saddlebags here, these can fall off, and on a hard stop, the monitor can land on the patient. So I always say make sure we have hard points of contact going through the handle here or some other point of contact. This guy will come through here. Make sure we cinch it down, make sure it's nice and secure. We're going to do the same thing on this side. Remember not to go over the saddlebag, but through the handle here. And securing, give it a little tug, make sure it's not going to fly off, land on the patient's lap or on the ground. All right, now that we have the tray connected and secured to the gurney properly and the monitor attached to the tray correctly using our hard points of contact, we are going to discuss how to hook up our patient to the monitor and program the monitor for our Q15 minute vitals. So one of the first things I want to do is I'm going to come into this side pouch here where we keep our BP cuff, electrodes, and pulse ox. So we're going to take this guy out, lay it on the patient, and organize our cords here. And the first things I want to do is hook up our leads. I know everyone's heard smoke over fire, white over right. So what we're going to do right now is go over our lead placement here. The X Series Zoll utilizes a 4-lead EKG. You can see we have our 4 electrodes already on the patient here. The upper chest, which can also be placed on the upper extremities, are our upper limb leads, which will be labeled RA and LA for right arm and left arm. Right arm, white, is going to go on that right upper chest, while our black left A or left arm is going to go on that left upper chest. We have 2 more here. We will have RL for right leg and LL for left leg, or we can attach to the lower abdomen here. Green is going to go on the right, lower right of the abdomen, and our red is going to go on our lower left of the abdomen. That's all we need to do right now for our leads. We have all 4 connected. Next, we are going to hook up our blood pressure cuff. Make sure you're using the correct size cuff for our patient. There are adults, small adults, child, small adult, child, and pediatrics or infants. We are going to be using the adult cuff today. Make sure that we check on the patient for any contraindications as far as what side we're going to be using. Make sure that they haven't had any previous surgery, vascular surgery. That's going to prevent us from utilizing blood pressure on either the right side or the left side, like a mastectomy, lumpectomy, lymph node surgery, or any dialysis catheters as well. Today we're going to hook up a patient on the right side here using the adult pad. Make sure when you are hooking it up, there is a label here for the artery, which we want to make sure is in line with our patient's artery here. That's that basilic artery here, right? Sorry, brachial artery. Make sure this is in line with the inside or the medial aspect of the arm, basically in line with that artery, and make sure it is nice and secure, not super loose or flopping around. It shouldn't be sliding up and down, so nice and secure. And then we're gonna take our quick connect on our blood pressure hose here. This is a quick connect utilizing the single port quick connect. If you end up having a BP cuff that has the dual prong quick connect, we will need to switch that out for a blood pressure cuff that should be in your monitor bag that utilizes the single prong. This guy will attach just by pushing in, connecting, and give it a little tug. Make sure that it's not going to pop off. So that is good there. Lastly, we are going to hook up our pulse ox. Again, with our pulse ox, I like to make sure that we utilize it on the opposite arm of the blood pressure cuff, so that way when it takes the blood pressure, it doesn't interfere with any pulse ox reading. But again, talk to your nurse, find out which one they like, which finger they like to use. Make sure that it's not a finger that has any dark nail polish on, which might interfere with any reading. So we are going to go ahead and just clamp that on here. This is the non-disposable pulse ox. The patient might already have a disposable pulse ox that's already on, which you should be able to utilize with our pulse ox as well. Make sure that it has a single cutout on the top and then a dual cutout on the bottom, and that will be compatible with our X series. Again, give it a good tug. When it's on, the red light should be lit up on the pulse ox, and that way you know it is actually reading. How to program our X series Zoll, turn it on, program our Q15 minute vitals, and any other buttonology we need to go over. So to turn on, we're just going to press and hold this green button until you see these lights light up. It takes a few seconds and it'll go through a self-check, do any tests. Self-test pass. At that point, we can start programming it. If we have our leads hooked up and we're still not seeing any leads here, we make sure we know what setting our leads are at. Right now it's set to pads. If you need to switch it to a different lead, like lead 2 or 3, whichever lead your nurse would like, the very top button here will cycle you through different leads. Most nurses like to monitor in lead 2, but it's up to your nurse discretion. Make sure you know which one they like to utilize. You can see a set of quick access menu buttons here. If I wanted to utilize 12 lead, I would hit this guy. That would turn on my 12 lead, and I can take a snapshot by pressing that button again, or I can exit out by pressing the bottom button, and that will take me back to the home screen here. If the nurse is utilizing end-tidal CO2 for a vented patient, it'd be the next button down. You would see your end-tidal CO2
register here. Once you hook it up to your vent circuit, then you would see your reading. You can turn that off now by simply pressing that button again. If I needed to print a strip, here's our print button. Hit it once, will print. Hit it again to stop your print. Anytime I want to get a stat blood pressure, there's a stat blood pressure button here. There is also some moving cursor buttons here and a select button. This is what we're gonna go over right now, how to set up our Q15 minute blood pressures. I am going to cycle through, and you can see the cursor moving until we get to NIBP. Once NIBP is highlighted, we are going to select in there, scroll down to where it says NIBP mode. It defaults to manual, but we want to switch it to auto. So once you are there, you will hit the select button again and scroll down one time to auto. Once that is good, you will hit select again and it will stay in the auto. Now we need to adjust our blood pressure interval. Right now it defaults to 5 minutes, but we want to set it to 15. So we're gonna go down to there, select, and move the button down to 15 minutes. Select again, and you can scroll all the way back to the back button and hit select, or you can hit the home button. You know you have configured it and set it up correctly. At the bottom, it should say auto 15. Now I will get my first blood pressure cuff by hitting the stat BP. It will go up. After it reads that patient's blood pressure, it will take a vital sign or a blood pressure every 15 minutes from that point on. If your nurse wants the blood pressure to be taken more often, Q10 minutes or Q5 minutes, you would just do the same thing, but change your interval to whatever setting the nurse would like. Access our defibrillation pads and how to connect that on the monitor. So again, I'm going to turn it on here. So blood pressure cuff, pulse ox, and electrodes are going to be on the left hand bag looking at the monitor. Our 12 lead cables and our defibrillation pads are going to be accessed on the right sided bag. In here should be a couple different types of pads. We will have pediatric and adult here. White is going to be for adults, can also be used for child. And then the blue is for infant and pediatric only. We want to make sure that the defib pads that we are utilizing say Zoll on it and not any other brand such as LifePak or Physio Control. These guys will go onto the patient and we will connect that. Is on any drips or any fluid where we might have to utilize our pump, or go over how to secure our pump to our IV pole. The pump is fairly large, can be a little heavy, so we want to make sure that we have this securely fashioned and tightened down really good so that it does not fall on the patient. The pump can also be mounted to the tray if we need to, and we're utilizing multiple channels and it's a little too heavy for the IV pole. We can position the monitor in the back and put the IV pump on the tray as well as, like I said, our ventilator or our Airvo. We can always utilize the tray for that as well. So, but for the pump, we're gonna go over how to mount it here and tighten it all down so that it doesn't fall on the patient. Again, it's in the up position. We want to give it a little jiggle, make sure that it is not gonna fall on the patient. Make sure it is all the way down into that position. We are gonna untighten this guy, bring it all the way up, and make sure we tighten this down nice and firm so that this guy does not slide down. And this guy will extend all the way up. Our fluid in our fluid bag will be hanging here while we mount our pump. utilizing our securing screw to the IV pole. I want to make sure that I don't have it up too high or too low. I want to make sure it is where I can access it or the nurse can access it. So I usually like to make sure it's on this middle section, definitely not up on the top section here. So I'm just going to screw this guy down again, clamp it down so it's nice and secure and tight. Give it a few good turns, just hand tight but nice and firm. Again, I'm going to check this and I'm going to check this bottom one too. Again, make sure that this is not going to slide down, land on the patient's lap, or fall off of the IV pole and possibly damage our pump. Make sure that we have the screen facing the bench seat where the nurse can see it and get at it. And make sure that any obstructions are cleared for our IV tubing.